Hello future parents, if you are looking for ways to ease your labor pain, to cope better with the contractions, look no further, you came to the right place. We're going to see in this video some positions that you can adopt in order to feel less discomfort during labor. Let's start with the video now. Hello everyone, midwife Ilenia here. For those who don't know me, for whoever came back to see more, thank you so much for being here. For all the new people, I am a midwife and I've been a midwife for over 7 years now. I currently live and work in the United Kingdom and I give information to new or former parents related to pregnancy, birth, postpartum and beyond. So in this video, I know those are one of your favorites because you always request for them. We are going to see some positions to help you cope better with labor. We know, if you've looked from some of my videos, but again there are tons in my channel about it, we know that the pelvis is a bony structure that has the capability, beautiful capability, to move and to adapt to the fetus, to your baby that is going through in order to come down and out to you. So we can help the pelvis in this process. We can move according to our instinct or the midwife suggestions or whatever feels good and better. We can move our body in order to make this process so much easier. The pelvis is divided in levels, and according to what level the baby is, then you'll find that a position works better. And don't worry, you need to know, you cannot know what level the baby is, but you'll be able to understand obviously in which position you're comfortable. Moving in labor is super important. You should move in early labor, in active labor. You should change position while you push. You should move also when you have an epidural. There are so many things that you can do with the help of your midwife or your birth support, but you will be able, you have to move. It's so important for you, for your baby. So let's see, what do you do to open the pelvis? And therefore, again, once you do these movements, that they feel good, they help you baby descend and they help you the contraction feel, they'll be less painful basically because you adopt a position that helps the work of your uterus. So the number one position that you have to do, especially in early labor when the contractions are starting, are squat. Do as many squats as you can, but not for training purpose. We don't have to train our muscles and our glutes. We just have to open the pelvis. So you can do a squat simply by yourself, or you could be supported by a yoga block or a towel, or you can even be close to your couch, for example, if you want to be in a supported squat like that. Remember, the feet should always pointing the external part of your body, and you should be able to relax and let your pelvic floor go. That's the main rationale of the squat. You could also do a supported squat with your partner. You could do a supported squat with a sling, with a kind of scarf or a sheet, a linen that you hang on the door if it makes you feel more supported. If you're having tough contractions and you're not able to do the squat by yourself, that's absolutely fine as well. When baby will go to the second level of the pelvis, which is the mid-pelvis, you need to create a symmetry in order for your baby to progress better. And you do that by using the ball, first of all. For example, if you sit on the ball and you do some lateral movements, alternating it with circles and bouncing, just create a symmetry. Also, go for a walk if you feel up to it. Or another thing that you can do is do lunges, maybe just lean on your couch edge, on your bed, on a step, whatever it works to do lunge, and just simply rock back and forth. Do the side that feels better first, but also do the other one, or don't do it if it doesn't feel good at all. Just always, again, follow your instinct in terms of that, because maybe baby might need to twist in a anti-clockwise mode or versus a clockwise. It depends from the position your baby will be. Another great position to create asymmetry, especially if you're tired or you just want to rest, is by laying on your side smartly. So you can do so with a peanut ball that I have here, or even some pillows will achieve the same goal. So you simply lay down with your bottom leg straight, and then the top leg, you put it on top of the peanut ball, and you should be like laying nice and resting there. If you have someone, just let them rock you back and forth like that. They should be able to relax you, and again, just create more space for baby to come down and out. Another great position to ease labor pain and just to relax your pelvic floor is by sitting on the toilet. The toilet is great. We have been trained from when we were toddlers to relax our pelvic floor in the toilet, and so why not to do so in labor? While you're sitting on the toilet, you have the gravity in your favor, and then you will just relax your pelvic floor muscle. Therefore, baby will be able to come more down, to dilate your cervix more, and then finally end the labor. Mind you, the contractions might be quite strong in the toilet, but I advise you to try to spend at least 3 contractions every hour or so in the toilet. It's very, very good. And you can do so, for example, while you go for a wee, and just stop by there for a little bit longer. Again, just don't be afraid of the toilet and use it, because there is something about the privacy and the relaxation that you feel there that, trust me, I've seen changing so many labors. Let me know in the comments if you've used any of this position, and as always, I'll see you next video. Bye bye!